Carolyn Cole, and I would like to welcome you to VGM-TV, a project of the VGM Group, which is headquartered in Waterloo, Iowa. Our program today is entitled Medicare, What You Don't Know Will Make You Sick. Our guests are Mike Mallaro, the Chief Financial Officer of the VGM Group, Inc. He's a regular national speaker and writer on home care issues and the U.S. healthcare system. He's been called a futurist because of his unique perspective on healthcare. Another guest is Ken Brown, Ph.D. He is the Lawrence M. Jepson Professor of International Economics at the University of Northern Iowa in Cedar Falls. He's been at UNI since 1994. He's also worked in supply chain management for a regional hospital system. Our third panelist is Kelly Turner, VGM's Director of Advocacy. Thanks for joining us on Medicare, What You Don't Know Will Make You Sick. After the doctor determines, for example, that you need oxygen in your home, as of this moment, and that is a key phrase here, as of this moment, you can choose the business that will provide it. There are about 12,000 of them in the U.S., and you may make that choice based on service, location, hours of operation, convenience. Home medical equipment is a critical part of the U.S. healthcare continuum. It allows people to remain in their homes, which is exactly where all of us want to be. It allows individuals to live as independently as they can, considering their condition. Earlier, I alluded to the fact that for the moment, a Medicare beneficiary can choose who will provide them with what they need. Unfortunately, that time is running out, thanks to a government program that is so inappropriately called competitive bidding. Mike, competition is the American way, isn't it? What's wrong with bidding competitively?
Competitive bidding is a clever name that people in Washington dreamed up for a scheme that's really about low bid, cheap, low-end health care. And what they've done is they've come up with a system where a segment of healthcare, home care, will be done only by the lowest bidder. It's the first time in our nation's history where health care has been diminished strictly to low bid. And it's disturbing for many reasons. You mentioned a couple of them, but a limitation on access. Seniors and folks with disabilities will have much less access to the kind of equipment they've been used to. Price is the only criteria in their bidding. There's no value put on service. There's no value put on quality. There's no value put on being in the community. There's no value put on experience or credentials in the business. It's strictly on price, low bid medicine.
Wow. How did this become law?
Well, it was passed into law in 2003 in the prescription drug bill. It was really this provision was slipped into that bill. That was a many hundreds of pages bill, but this provision was slipped in the middle of the night. It's a small paragraph that simply said that medical equipment used at home would be subject to a bidding process. And from there, some bureaucrats in the Center for Medicaid Services came up with the specifics in this scheme that ultimately just award all the medical equipment business to low bidders.
So we have reduced health care to a Walmart model?
Well, you mentioned right now there's 12,000 providers of medical equipment. Most of them are community-based. Over 75% of the business that's done in the United States is done by community-based providers. They might be a standalone home medical equipment store. They may be a pharmacy. They may be a hospital, community hospital-based medical equipment dealer. There are a few national chains in the business as well, but it's predominantly a community-based business, and that's typical of things that are very high service-intensive businesses. Are typically done through community-based models, and so that's how this business is. But there's people in Washington, bureaucrats, that believe that they're better at choosing who the best providers of medical equipment are than the patients.
Who is supporting this and who's against it? I mean, have people gone to Congress and said this is ill-informed public policy?
That's a good question. A lot of people have opposed this. In fact, interestingly enough, there's over 250 members of the House of Representatives. A majority of the House of Representatives has signed onto a bill that would repeal this crazy bidding scheme. The problem is that the Senate has not provided the same level of support. So it's not a partisan issue. That's another thing that's interesting about this. All 5 of Iowa's members of the House of Representatives, from a very conservative Steve King in Northwest Iowa, to a liberal Dave Lobsek, to Bruce Braley, Leonard Boswell, Tom Latham, all 5 of them oppose this concept and have signed a bill to oppose this concept. So it's not a partisan issue. It's not a Democrat or Republican issue. It's simply a public policy issue that doesn't make any sense. As you pointed out, we have an aging population across the United States, baby boomers aging and swelling the ranks of our seniors, people with disabilities. These are a frail and vulnerable part of our society, and these are the people that are going to be hurt by this low bid scheme, this low bid medicine that bureaucrats in Washington are trying to push down our throat. The bidding process has occurred. On January 1st of next year, 10 major cities will convert to this system, and they will be the first guinea pigs to try it. And then there'll be another 90 metropolitan areas 2 years after that. So the effects of this bad medicine will begin to really be seen at the first of the year in 10 cities, and then we'll start to see it in Iowa and in other parts of the country in the latter part of 2011 and 2012 and 13.
And then it will be rolled out nationwide?
Be rolled out to the 100 largest cities directly, but there'll be a tremendous indirect effect as well, and Iowa will be affected in a very negative way. Especially our rural communities and our smaller towns across the state of Iowa are going to see a significant deterioration in their access to medical equipment as a result of this bill.